Association دكتور رافد واللجنة التنظيمية للمؤتمر على دعوتي للقاء هذه المحاضرة. So this case presentation also is from Bedford Hospital, part of Bedfordshire Hospital. This one can work. Bedfordshire Hospital, and I'm working in Bedford Hospital. So my title for presentation is Impact of COVID-19 on Clinical Practice. I'm not going to talk anything about COVID-19, because I'm sure every one of you oversaturated with the information and diagnosis and everything about COVID. But I would like to talk about the duration of COVID and what happens to the clinical practice. And as we all know, that so during the COVID-19, a lot of jobs and specialties, they work from home or virtual work, but for clinical work it's very difficult. And just to mention that for the clinical work is very important, and we'd like to discuss the issue with this one. William Osler, maybe all you know William Osler, and this is a common thing we can discuss for the student and for the postgraduate assessment regarding Osler sign, Osler node, Osler phenomena, a lot of things. And he's a very famous doctor, and he's the one who created the residency program. So he started to do the residency program for the trainee doctor to be in the hospital, and he's the first one who started to push the medical student to come to the hospital other than to stay in the classroom. And he said, he who study medicine without book sailed an uncharted sea. يعني اللي يقرأ الطب بدون كتاب كأنما رايح البحر أظلم ما يقدر الطريقة. But he who study medicine without patient does not go to sea at all. كأنما ما رايح البحر أساسا. Our work is very important to be book and patient. Then I will go to my case presentation. This is very young female, 16-year-old female, presented with palpitation, abdominal pain, vomiting, no bowel opening for 1 week, and period bleeding. So in this case, when we came to the ED department, or we call it the hospital, it would be of different specialty. It could be from cardiology, palpitation, or it could be from surgical point of view, or it could be from the gynae. So the ED doctor assessed this patient, and by the way, the age of 16, also during the COVID time, pediatrics said no, our age is 16 and below, and adults said no, our age is 18 or below, because everybody tried to reduce the number of the patients and reduce the exposure to the patients. So when they tried to assess it on clinical bills, patient took pair with mild gastric tenderness, chest clear, and heart normal S1 and S2. He asked for some blood tests, and the blood test showed her hemoglobin was 96, and in her previous record, hemoglobin was 125. Other parameter of white cell count, platelet, everything was normal. So he asked for chest X-ray, and the chest X-ray, because of the hair presentation, this is her chest X-ray, and the report as both lungs showed poor inflation, no focal area of collapse, consolidation, cardiac and the spinal outline with a normal limit, no pneumothorax, no pleural effusion. So they rule out any acute things. The doctor also asked to do a plain abdomen X-ray. The plain abdomen X-ray, also the report was bowel gas pattern is non-specific with no evidence of obstruction or perforation. So almost they rule out any surgical. He tried to be more proactive and tried to ask for ultrasound abdomen, and the ultrasound also was reported nothing significant apart from simple cyst in the kidney and trace of fluid which is within the normal limits. So in this case, they don't know where to go, and surgeons say not for surgical because all these things are normal, and the gynae said it's simple bleeding, could be ulceration rather than any significant bleeding. So go to medics. As the normal practice everywhere, a lot of country I work, everywhere patient from no surgery, no gynae, go to medicine. So this is very good example of always patient, in spite of all these wounds, but the surgeon wants to push under medicine because the patient is diabetic. So the patient take over by medical department, and the clinical assessment after maybe 2 days when she start to be under medical department. Young female, pale, uncomfortable, holding her tummy, her abdomen with recurrent vomiting. I saw her, she's a very young girl, thin girl, holding her tummy, moving in the corridor, and get a lot of vomiting. Chest is normal, heart is normal, S1 and S2, no added sound, so we don't have anything for palpitation. Blood pressure was normal, and the pulse rate was 105, which is in normal acceptable range of the sinus, so not very significant. But her hemoglobin was dropped to 75. Other parameters normal. I don't know whether this hemoglobin dropped because there are no active bleeding during her admission, but the drop in the hemoglobin could be because of after fluid start to get some hemodilution and then get drop in the hemoglobin. So we review the X-ray again. We can say in the X-ray it's not very normal, although there is no surgical issue, but the gas shadow of the stomach is not very acceptable. Because as if there are two parts of the gas shadow, not a single part of the stomach. And the X-ray of the abdomen also very strange. The report said non-specific gas pattern, but this is the transverse colon. There's shadow here, something wrong. There's no gas shadow here. So that's why we need to do further. I try to ask for CT abdomen. But the CT abdomen is very difficult to convince the radiologist, so we need to discuss with the radiologist why we ask for CT, because the chest X-ray, plate abdomen, ultrasound are normal. So we discuss with the radiologist and we convince him that this is the patient with significant drop in the hemoglobin. We need to do CT abdomen right away, in spite of normal X-ray and normal ultrasound. So the CT was very significant finding. There's some shadow here in the stomach. And the radiologist start to discuss with the patient, because when we convince him, he wanted to discuss with the patient herself. So there is a shadow in the stomach region, and the gas pattern shifted to other side. So after discussion, he said, I noted there is a large volume of mixed attenuation material within the stomach and the first and second part of the duodenum. He discussed with the patient, and she told him that I got only small sandwich of ham, which is not proportional to the fullness of the stomach. He said, I cannot go further. Please, can you ask for OGD? So we asked for OGD, and the OGD done after maybe 2 days for addition. Large ball of hair filling up entire stomach, right up to the cardiac. She informed us that she has the habit of eating up her hairbrush over the years, and the ball cannot be removed by endoscopy. And he suggested to go for laparotomy, gastrostomy, enterotomy, whatever, and we call it large bezoar. So also, as we are talking about Iraqi doctor everywhere, and this one endoscopy is also one of the Iraqi colleagues. He's very keen and sincere in his work. I told him, please doctor, try to remove it, because we know the surgeon at least in front of the patient and medics. He said, Aouf. Do you remember the coconut in Iraq? I told Josier, I need to get hair one by one for this ball. Very difficult to get. It is the same size of the coconut in the stomach. So very difficult. She go to the by surgeon, because she cannot be removed unless by laboratory. So refer back to surgeon, and the surgeon suggested that the registrar came to my registrar, told him that give her cola. So I told him, go back to him and ask him, what cola? Diet, Pepsi, Coke, can, or bottle. Then I discussed with the consultant. I told him, no, this is not the way. Because the patient, I accept the patient, but this is big ball of hair needs to be removed surgically. And then we convince the surgeon and thank for the surgeon to take over. So just a few words about the cola. Yes, cola can work because as we know, sometimes when you have some indigestion, everyone tries to get one can of cola because of carbonic acid and phosphoric acid and the low pH of the cola can help to dissolve something and also can create some bubbles to enhance the movement of the stomach. And a diagram for the following the many study, they mentioned that cola can help when there's some residual debris in the stomach can be of help, but not for this size. And as we know from the physiology, the gastric emptying maybe 30% or 90% can be remain in the stomach after 1 hour, and after 2 hours maybe 60%, and even after 4 hours you may find 10% of the gastric residual still in the stomach. So not easy to get emptying of the stomach. So the surgeon referred back and he got this bag. This much of hair impacted in the stomach and the duodenum over years. So obviously this patient when get small sandwich, definitely she will get fullness and abdominal pain because there's no space in the stomach. And 16 years old. So they did laboratory for hair, remove everything, angio-tube, and recover very well. So just a few slides about the bezoar. I think we still have time. Okay. So bezoar is a mass of undigested material found in the gastrointestinal system of many animals and can be found in other locations. And sometimes stone-like material. And it's worked as antidote. And for so many years they use it as anti-poison. And by the way, the bezoar, the term bezoar may be from Arabic, said in the literature, not from me. In the literature said from bad zahar. Bad zahar or Persian word pan zahar. احنا بالعراق يمكن مرات نقول يعني هاي سمسم بين المزوهرة. جزئية same word يعني أو مزوهر يعني something get some poison in the stomach or something like that. So for so many years they use this bezoar as an antidote because it is a collection of different regions and different material and can get antidote from that material. High risk of bezoar, those people with high risk of bezoar is a patient post-gastric surgery because of delayed stomach emptying or decrease or reduced stomach size after some operation, or patient with diabetes or end-stage renal failure also can get delayed in gastric emptying. One type of bezoar, they call the trichobezoar, I will discuss later, is occur in patients with psychiatric illness and develop some development or mental disabilities. Bezoar are classified according to the main classification 4 types or sometimes 3 types with 1 subtype. The main common type is the phytobezoar, is indigestible food fibers such as cellulose, fruit, vegetables, and the most common is almost 40% of all types of bezoar. There are some subtype of bezoar called lactobezoar. This happens in premature children or newborn children as a residual amount of some material from the milk. But the trichobezoar, just like our case here, trichobezoar is a hair or hair-like fiber, such as garment or clothing fiber, in severe case known as Rapunzel syndrome. It is most common in adolescent girls with history of psychiatric disorder, habit of hair pulling, and trichophagia, and eating the hair, just like our patient. And the last type is the pharmacobezoar, is when residual part of maybe sometimes capsules or some medication can take 3 minutes. Symptom as our patient, symptom, treatment, usually by endoscopy, because endoscopy can diagnose and can remove the bezoar. Metoclopramide, The enzyme, because most of the time they said the phytobizar is cellulose-like, so cellulase, the enzyme, can be helped, and cola can help, and there are some literature give the cola for small part, not coagulation, for small residual part, as by NG tube over 12 or 3 liters of cola can also help. Prevention, chewing the food properly with proper fitted dentures. Trichophagia psychiatric assessment definitely, and phytobizar need to be also very careful. And the phytobizar example, this one, persimmon. Persimmon is very, very common. They call it khaki, very thick skin is not commonly to get bizar. And other type of bizar, celery. Here in the UK it's very common celery, persimmon يكون هذا يشبه البروفيسي بالعراق بس very, very thick stuff, or pumpkin, sunflower, and melon. نص دقيقة بس حتى نبقى يعني during my research in التجريد بالصيف يجون كثير من الشباب ياكلون البطيخ يعني من حر الدنيا بالجزيرة ياكل البطيخ هذا شباب صغار بعدين يشبع البطيخ يقوم ياكل حر ورا المغرب بالليل يجي بطن متفخه وما تحل الا باوبريشن. Maybe some of you come across some other material can be also causing this bizarre. And last slide, just like Dr. Rafet said, patient is our priority. And also William Osler said, the good physician treat the disease, the great physician treat the patient who had the disease. And thank you so much.